When an elderly patient refused her care because of the color of her skin, Mary Jones, an experienced and dedicated Black nurse, had no idea that her professionalism would soon save his life. His anger and contempt poured out in complaints, threats, and humiliation. But this was only the beginning of her trials. And when, struggling with both pain and pride, she extended a helping hand to someone who despised her solely because of her appearance, no one could have foreseen what would follow. The events that unfolded would astonish even the most resilient among them. But let's start from the beginning. Mary Jones, a Black nurse with 12 years of experience, arrives at the clinic ready for a new workday. Her first task of the day is to assist an elderly patient, Harold Spencer, who has come in for a cardiovascular assessment. As soon as Harold enters the room, his gaze hardens. Mary greets him, but she notices his body tense. "Excuse me, miss, but I'd prefer a different healthcare provider," he says, avoiding eye contact. Harold looks her over with distaste and irritably adds, "I'm not comfortable with you. Couldn't you get someone else?" Sensing the rising tension, Mary maintains a calm and professional tone. She politely explains that she is currently the only healthcare worker available and asks him to sit down, reassuring him that she'll do everything possible to make him comfortable. But Harold doesn't relent. He raises his voice, demanding that she be replaced and accusing the clinic of incompetence for not providing a proper employee. Harold's raised voice draws the attention of patients in the hallway, and the atmosphere grows tense. A doctor, alarmed by the commotion, peers into the room and notices Harold's overt hostility toward Mary. The doctor gently asks him to calm down, explaining that Mary is one of the clinic's most respected staff members and a skilled professional who can be fully trusted. Stubbornly looking the doctor in the eye, Harold refuses to accept this information, insisting that he has the right to choose. The doctor once again explains politely that only Mary can perform the procedure at this time, and refusing her help could impact his health. Nevertheless, Harold remains adamant, standing up and threatening to file a complaint about the unacceptable conditions. Mary, watching this scene unfold, feels the sting of injustice but tries not to show her emotions. Patients in the waiting area, who have known her for a long time, exchange glances and voice their support for her. One woman sitting nearby says loudly, "Mary is the best nurse, and I always come only to her. I'm sorry that some people don't understand that." Other patients chime in with stories of how Mary helped them in difficult moments, always showing care and compassion. At this moment, Harold, seeing the genuine support around him, falls silent but remains steadfast, his face reflecting only irritation and a refusal to back down. After the tense confrontation with Harold, Mary returns to her work, doing her best to ignore his insults. Bitterness wells up inside her, but she remains composed. Friends and colleagues, noticing her dejected mood, express their support. One of the doctors, Dr. Lewis, quietly tells her, "Mary, you know we all appreciate you. This man just doesn't realize what he's missing." Dr. Lewis's words help Mary regain her confidence, though the situation still leaves a bitter aftertaste. Meanwhile, Harold goes to the clinic administrator, demanding a meeting with the management. He claims to be outraged by the lack of professionalism and says he plans to file a complaint against the nurse. The administrator tries to de-escalate the situation, explaining that Mary is one of the clinic's most respected staff members, with years of experience and outstanding patient feedback. However, Harold remains unyielding, asserting that he will never be treated by her again. The conflict becomes the talk of the clinic. Many patients, upon hearing what happened, speak out in defense of Mary. Several people waiting for their appointments openly state that they trust only her. One patient, Mrs. Carter, tells the others how Mary helped her through a difficult surgery, offering support when other nurses were simply doing their jobs. "She's not just a nurse. She's a person with a big heart," Mrs. Carter says, and her words resonate with the other patients. Meanwhile, Mary heads over to Harold, who still sits in the waiting area despite his dissatisfaction. She decides to try once more to resolve the conflict. Calmly and with dignity, she says, "Mr. Spencer, I understand that you may not be used to me, but my job is to help all patients. If you change your mind, I'll be happy to assist you." Harold averts his eyes, clinging to his resentment, though a flicker of doubt crosses his face. He replies sharply, "I'm used to choosing who treats me, and I don't need any exceptions." Nonetheless, Mary's words begin to reach some of the clinic staff. The administrator and doctors make a decision to support her professional reputation. After a meeting, they decide to publicly recognize her contributions and publish an article on the clinic's website highlighting her role and importance. Harold, sitting in the waiting area, can't help but notice the respect patients and staff have for Mary. He sees how people rally around her and how the clinic stands behind her. Gradually, he begins to realize that perhaps he judged her unfairly. A few days later, Harold returns to the clinic for a follow-up exam. Today, his doctor is delayed due to an emergency, and the administrator asks Harold to wait in the lobby. Still harboring hidden resentment, he shifts impatiently from foot to foot, casting angry glances around the clinic. Suddenly, his face contorts in pain, and he clutches his chest, struggling to keep his balance. Mary, nearby, immediately reacts to the situation. She approaches Harold, who, clenching his teeth, tries to pull away, but the pain is too overwhelming. "This isn't the time for arguments, Mr. Spencer," Mary says firmly. "I need to check your condition." Without waiting for a response, she professionally assesses his symptoms and realizes that immediate action is needed. Mary guides Harold to the nearest couch, expertly checks his pulse and blood pressure, starts oxygen therapy, and prepares an injection to ease his pain. Throughout the entire process, she remains calm, issuing brief instructions to other staff members and displaying unwavering professionalism. Her colleagues watch her, amazed by her composure, especially given the recent conflict with the patient. As Harold's condition gradually stabilizes, he comes to, surprised by her quick response. He looks at Mary in astonishment, realizing that without her intervention, the situation could have ended differently. It strikes him. Despite his rude behavior, she stepped in to help him without hesitation, which stirs a conflict within him. Accustomed to judging people by appearance and dismissing their true professionalism, he finds himself experiencing an unfamiliar sense of gratitude. While Harold remains under observation, staff and patients who witnessed the incident talk about Mary's professionalism. Her colleagues remark on how her swiftness and confidence saved the patient, sharing stories of her dedication to her work. One of the doctors shares this incident on social media, recounting how a biased patient was forced to reevaluate his views, thanks to the nurse's genuine professionalism. Observing all of this, Harold realizes that his prejudice was unjustified and unfair. He feels embarrassed by his actions and begins to understand, deep down, that he owes Mary his life. After the incident, Harold remains under observation for several hours, reflecting on what happened. It isn't easy for him to accept that he treated Mary so harshly and unfairly, the very person who saved his life without hesitation. For the first time, he starts to question why he harbored such prejudice toward her. He feels shame mixed with gratitude and decides to stay after his examination to talk with her. When Mary comes over to him for a final check, Harold speaks softly, almost inaudibly. "Ms. Jones, I was wrong. Please forgive me. You saved my life despite how I treated you." His voice trembles with both embarrassment and relief, and he looks up at her with genuine regret in his eyes. Mary, accustomed to prejudice, hadn't expected an apology. She replies gently, "I was just doing my job, Mr. Spencer. My duty is to help all patients, regardless of how they feel about me." Her eyes reflect kindness and understanding, and Harold sees that behind her words lies a true inner strength that he had previously overlooked. Soon after the incident, the clinic's management decides to recognize Mary's contributions by writing about her professionalism and patience in an article posted on the clinic's website and social media. Mary's story garners attention, and her name becomes a symbol of professionalism and kindness. Patients who read the article begin to share it, including those who have already experienced Mary's care firsthand. Over time, Mary's reputation grows. Patients now specifically request her, having heard about her resilience and competence, and the clinic receives numerous letters of gratitude asking for her by name. For Mary, this recognition is more than just praise. It is validation that her belief in kindness and patience is justified. Harold returns to the clinic a few weeks later, and this time he insists on booking his appointment specifically with Mary. During his visit, he thanks her for giving him a second chance and promises to reevaluate his attitude toward people. He tells friends and acquaintances about her resilience, and his story begins to influence others in his circle. As Mary observes the changes around her, she feels a deep sense of fulfillment. Her patience and professionalism not only helped someone, but also transformed his outlook. She understands that her dedication to her work can be inspiring, and this realization gives her even more strength to continue her journey.